Pro Group Management. Workers' comp that works for you.
Welcome to Nevada Newsmakers. On the broadcast today, Elyse Monroy-Marsala joins us. She's the president of the Northern Nevada Harm Reduction Alliance. A fascinating show on an all-new Nevada Newsmakers.
Welcome to the Winnemucca Big R.
Hi, I'm John Walker. Welcome to Big R Lovelock.
Hi, I'm Rich Martin. Welcome to Fallon Big R.
My name is Braden. Welcome to Big R Fernley.
Hi, I'm Kelly. Welcome to Big R Sparks.
Everyone is talking about opioids, but they're not the only drugs that can be harmful if taken in large quantities or not as prescribed. You also need to be aware of side effects from anxiety drugs, muscle relaxants, sleep aids, and stimulants. Mixing prescription drugs with other drugs or alcohol can be dangerous. If you take an Ambien with a glass of wine, it may be enough to stop you from breathing. Prescribed drugs can be just as dangerous as illegal drugs. Take medications only as directed.
For 50 years, Nevada Heating has been keeping people comfortable in their homes. At Nevada Heating, call the Do It Right guys and get the air conditioning back on today. That's the Nevada Heating way. Why sweat for days on end when Nevada Heating can get your air conditioning fixed today? Call us today and we'll fix it today at 323-5585 or schedule us on our website at nevadaheating.com.
Save money and take transit. Did you know you can ride the bus all day for less than what it would cost you for a gallon of gas? Plan your trip now by going to rtcwashoe.com.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, we're always pleased to welcome back to the program Elyse Monroy, who is now Elyse Monroy-Marsala. Yes. Congratulations on your wedding. It's been a little while, but it's a pleasure to have you back on the program. And you are currently president of the Northern Nevada Harm Reduction Alliance.
That is right.
Who are they?
So the Northern Nevada Harm Reduction Alliance is a new organization that actually people who have been using drugs and are in recovery have been working to build for a number of years. We actually just got our nonprofit letter yesterday, so we're official from the IRS. But we are working to expand the provision of harm reduction practices in Northern Nevada. So what this looks like would be trying to get naloxone, fentanyl test strips, and clean syringes into the community.
And how is that going so far?
You know, it's going well. One of the things that we're working on now is trying to get, or supporting folks in trying to get naloxone available on UNR's campus. Currently, students at UNR don't have access to naloxone on campus. So if there's an overdose, or a suspected overdose, like in the dorms, for example, the RAs, the resident advisors, are told to call 911 and wait, which is unfortunate because overdose doesn't have to be fatal, and if there's prompt response, the outcomes are better.
Okay, so how big of a problem is this? And for those that don't know, what is naloxone?
So naloxone is an opioid antagonist, so it can reverse the side effects of an overdose. Oftentimes, people think about it like an EpiPen for an opioid overdose.
How big of a problem is this on our university campuses?
Well, I don't know that it's, so I don't have data to say how big of a problem it is on our university campuses. We know that when we look at the people that are dying by unintentional overdose in Nevada, really the people between the ages of like 18 and 34, 44 are those that are most impacted. So those are people that are dying by unintentional overdose. And we also know that in areas around college campuses, people party, and with what the drug supply is today, experimenting, trying is just a lot more dangerous. So we want to make sure that people have tools to help stay alive.
You've been dealing with this on and off in different ways for several years now. And it just seems that, people talk about the 60s as being, the drug era. And certainly there were drugs and there were dangerous drugs, but it seemed like the effects of those drugs took time. People that I knew from back then who were abusing cocaine but didn't know how dangerous it was. I talked to them years later. They had figured it out, they had recovered, their whole lifestyle had changed. They had time. It seems that right now with these drugs that people make a mistake, there is no time.
Well, and illicitly, so what we're seeing what people who are using, and the Harm Reduction Alliance, we work really hard to center, despite me being here, I've never dealt with addiction, our alliance tries really hard to center people with lived and living experience. What they're seeing is a lot of illicitly manufactured fentanyl appearing in the drug supply, and it is just making drugs more fatal. But there is a way for people to, if people don't use alone, if they can test their drugs to know what's in them and have naloxone, overdose can be preventable.
Okay, what you just said is totally common sense, and at the same time, on hearing that, one goes, that's kind of crazy that A, that people are taking drugs that are that dangerous, B, that they would have the presence of mind to test the drugs before they took them. Because if they were to that level of consciousness, perhaps they wouldn't be taking the drugs in the first place.
So I think I'm going to push back on that a little bit, only because I think that there is an assumption or an idea that every person that is using drugs or living and experiencing addiction is in a chaotic situation and has a chaotic relationship with drug use. That's not the case. There are many people that get to managed use of drugs. I would actually argue that there are many people that experience managed use of alcohol, which is also a drug that our government has determined is okay for us and gives us a safe supply and taxes. People can get to managed use when they figure out how to dose appropriately. But all of that doesn't happen alone, right? That happens with the support of harm reductionists and people who can help people figure out how to mitigate the harms of the use, the drugs that they're using.
The other side of this, of course, is that prescription drugs in a lot of ways are just as big a problem, because people have become so addicted to these drugs that they can't get off of them. And so you take something that should be a temporary measure, and then years later people are still taking these drugs, and doctors have a need to get people into a functioning state, and so therefore they keep prescribing these drugs, and it's kind of a vicious cycle.
Yeah. Well, on another show I can come in and rail against our healthcare system, right? Until we move away from a fee-for-service based system and start compensating or paying doctors for outcome-based care, I think we're always going to be caught in that. Well, here's a medication, here's a pill that you can take, and then another pill to manage the side effects. So we can talk about that another time.
Okay, well, now that you've opened the door, do you see that realistically in your lifetime? Because you got a lot of life to go.
I hope so. I hope so. We have to find a way to take care of people in a better way, and the current system isn't working, it feels like. And and I think we can also bring this back to drug use. It's really hard in our current healthcare delivery system for people to even access drug treatment. So, harm reductionists work to keep people alive so they have the opportunity to go to treatment when they're ready. And we have a health insurance system and a healthcare delivery system that even makes that hard for people to access.
Yes, to say the least. And then you've got new things coming in that are fascinating to watch, which, for example, like marijuana lounges. We've got a couple of legalized ones in Clark County now. They're putting in all kinds of rooms, and our good friend Tick Bloom has been, overseeing this for a long time. It's interesting that you can leave your car in the parking lot overnight and not get towed because you may have to take an Uber home. They're trying to do everything they can to mitigate this, but I just think it's fascinating to see how we are progressing in this system. And I'm not against it. I'm just an observer going, well, this is another interesting development.
Well, and I do think it's another example of, and this is kind of, I think, where the libertarian in me comes out a little bit. The government has deemed alcohol okay, marijuana okay, so much so that we'll give people a safe supply of it and tax it. But we've drawn this line in the sand at things like stimulants and opioids. But if your drug of choice is on that other side of the line, you're stigmatized. You're at risk of criminal charges and things like that. So once I started to kind of look at that, what I feel like is an iniquity in our country's drug policies, wanting to work to support harm reduction became a very easy decision for me.
And this is not something new. I mean, this goes back in a big way to the Nixon administration. I mean, this is just not something, and that was a lot of rules were put in place for political reasons rather than medical reasons, and discriminated against a lot of African American and Hispanic people because of those laws that were put in place. And those are being changed now. But drug use, like a lot of other things, has been around forever, and it's not going to go away.
Yep, it will continue to be around, so it's important for us to give people the tools to use safely.
So, I mean, when you look at fentanyl, I mean, how do you look at it as a recreational drug that can be managed, or do you look at it as something to a hair on fire kind of situation?
So I was on a call with a treatment provider a couple weeks ago, and something that they said was they're actually starting to see people come into their treatment center that have figured out how to dose fentanyl safely, so they're not getting to that point of overdose. I think there's a lot of messaging that happens to, we see a lot of news stories about police officers touching fentanyl and overdosing. That doesn't happen. That's not how fentanyl works. So people have been able to figure out how to dose and use it safely. The community of people that use drugs and harm reducenists help to promote and support that education. Just because someone is using something, there are ways to mitigate harm. So people have figured out how to dose fentanyl safely. Or more safely. I shouldn't say safely. To dose it in a way to mitigate the risk for overdose.
Right, and I mean, let's face it, walking outside of your house and crossing the street, you try to do it safely, but you can get hit by a truck. It was interesting, the mayor of Sparks was on here a few months ago, and we were talking about marijuana lounges, and he was concerned that police and fire going into a marijuana lounge would be tainted by the marijuana smoke, and therefore they didn't want to legal, and it was a very convoluted route. So, when you talk about fentanyl like in that manner, it's like, there are a lot of reasons being pushed on the other side of this that don't necessarily, to me, make a lot of sense. I mean, I think that all of these things need common sense applied to them, because this situation, I don't even want to call it a problem, this situation is not going to go away. I mean, if somebody's religious, you can look at the Bible and go back to how long we've been drinking wine.
Right. Yeah.
All right, let's take a break. We'll be back with Elyse Monroy-Marsala. Now we're going to the Bible, right after this timeout.
Story County is leading Nevada. Home of the Tahoe Reno Industrial Center, Google, Tesla, Panasonic, and other world-leading companies. Story County provides thousands of tech, advanced manufacturing, and logistics careers for Nevadans. We're diversifying and driving Nevada's economy and generating millions in tax revenue and billions in economic activity across northern Nevada. Story County is leading Nevada's future.
Retail's impact on Nevada's economy? Enormous. 8,600 businesses, large and small, employing 145,000 workers. And last fiscal year, retail paid tax on nearly $60 billion in sales. We're the Retail Association of Nevada. We support retail, we help it grow, and we mean business.
RANNV.org.
Pro Group Management specializes in providing industries with the necessary components to satisfy and exceed workers' comp requirements. Every business has unique needs and specific regulations. Pro Group Management stays ahead of the curve, providing up-to-date services to keep your industry in top form. Discover how we simplify your tasks, improve efficiency, and reduce expense to keep you moving in a positive direction. Pro Group Management. Workers' comp that works for you.
Early in the morning or throughout the night, professional truck drivers are on the job, serving you, safely moving freight that's crucial to our economy. From the oldest industries to our newest innovators, from the exotic to the everyday, trucks are everywhere, moving everything. Never afraid to embrace a future that makes Nevada and our nation stronger. Trucking moves America forward.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Elyse Monroy-Marsala. She's president of the Northern Nevada Harm Reduction Alliance. Billions of dollars in opioid settlement money coming to the state of Nevada. Literally, how much is there, and how is it going to be spread out?
So right now it sounds like the state has brought in about $1.1 billion.
Stunning amount.
Yeah, and that has come in through what's called the One Nevada Agreement. So the state is getting settlement money, and then all of the jurisdictions, the local counties and cities that also had opioid lawsuits are getting their own kind of tranche of funding out of the One Nevada settlement. So I'm actually on the committee helping to guide the state's spending of their money. So at this point, the state's opioid settlement dollars have funded, they have about $6 million that they're pushing out into the community. They have prioritized and have funded, a lot of treatment, drug treatment specifically, treatment alongside the court system, and some public safety and surveillance initiatives.
Okay, so is this considered a mental health issue or just a drug policy issue?
So the opioid settlement?
Well, I mean the way that they're applying the money.
Well, so the settlements are intended to mitigate, the lawsuits come in and they say to mitigate the harms associated with, inappropriate overprescribing and the opioid epidemic. And so it's a multifaceted issue. I've heard some physicians say that, or some folks say that, once someone is addicted, they have a mental health issue that needs to be treated. So we take mental health and then substance use together, and that's kind of the field of behavioral health.
It seems like almost every problem we have in society rotates around mental health at some point. Mm-hmm. And I don't see where we have in this country, let alone in Nevada, the number of mental health professionals needed to be able to deal, and certainly drug counselors to deal with the level of problem that this is.
Yeah, so Nevada has been a federally designated health professional shortage area for mental health providers for years.
Oh, well over 40 years.
Yeah, for years. And that's a problem that is not going away. But also, I think that, and and we talked in the first segment about the healthcare system. I think sometimes we over-medicalize mental health in a way. We know the things that help to mitigate the harms of mental health, right? It's connection to community. It's not being alone. It's like community resilience and community connectedness, that yes, we need mental health providers. Yes, we need psychiatrists. Yes, we need people to prescribe medications to help people get chemically balanced if they're not chemically balanced. But to address our mental health crisis, we need connection to community and connection to people, and that's not something that insurance will pay for.
So that brings up COVID and a 2-year period where that connection was severed for so many people, especially young people. How is that reflecting upon all of this?
Well, you know, I definitely think that one of the challenges of COVID, we definitely saw drug use go up, right? We also saw overdoses go up because people were relegated to using alone in their homes. And that's one of the biggest drivers of unintentional overdose is using alone. So that kind of cut off from community, it hasn't helped. You know, we're in 2024, things have opened up, people are in concerts, people are going out and having meals, so hopefully things get better. Yeah, I don't have a better answer than that, but yeah.
It just seems to me that we're going to be dealing with the fallout from this, from that younger generation that was graduating high school but without any of the things that normally are associated with graduations, entering the college era of their life without the ability to actually be in college. It just seems like there's this whole social piece that's missing, and it was hard enough prior to have relationships. And so for a lot of those people, it seems like we're going to see a delayed response in terms, sadly, of negative issues. I don't know how, we address that.
Yeah, I don't have an answer. I was actually thinking about COVID just the other day. And, I don't know if you saw, I'm sure you did, Sam, but the boat that hit the bridge in Baltimore, one of the news reporters said it was like this 1,000-ton barge that lost power and then couldn't be stopped and then hit the bridge, and that collapsed, and it's going to take a really long time to repair. I kind of feel like that's what happened with COVID, is we had this country, our society was this 1,000-ton barge that we just tried to stop, and you can't stop something like that on a dime and then just expect the bridge to be fixed tomorrow. It's going to take time.
To say the least. All right, let's take another break. We'll be right back.
What do you count on? You count on your power every day. At NV Energy, we've always powered what's important to you, but we're not looking at the past. We're focused on the future. While our standards are high, our rates will remain low, and our commitment to renewables isn't just meeting standards, but leading the way, because you can count on more than just your power. You can count on the company who brings it to you. That's our promise. You can count on it.
The Nevada Builders Alliance has been protecting the interests of the construction industry for over 50 years. Our programs save members thousands of dollars every year and allow them to provide much-needed benefits to their employees. Our industry also allows Nevada to grow. If you're thinking about a career in the construction industry, reach out. And if you haven't thought of a career in construction, what are you waiting for? We are the Nevada Builders Alliance.
Turn your clunker into a caddy during the Cadillac and Cash giveaways at Tamarack Casino. Weekly cash drawings including $5,000 cash and one top prize of $10,000. Win the grand prize of a Cadillac CT4 or $40,000 in cash. Your good times are at Tamarack Casino.
As you know, Reno is booming. Toll's development company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com.
7 at 7 is a newscast built for your smartphone. It's a 7-minute newscast available every weekday at 7 a.m. and 7 p.m. at lvrj.com. We don't waste your time, and we give you the day's top stories.
We at the RJ have noticed some similarities between us and a certain BTS character, RJ.
Plus the latest in Las Vegas business, weather, health, and entertainment news. 7 at 7 streaming now on your smartphone.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Elyse Monroy-Marsala, president of the Northern Nevada Harm Reduction Alliance. Bad Batch app. Explain.
Yes. So in the last couple years, the Northern Nevada Harm Reduction Alliance partnered with an area senior, like a senior in high school, who was working on a service learning project, and they developed an app that people who are using drugs or people who know someone that is using drugs can sign up for. It's called Safety Outreach System. You can get it in the Google Play Store, and people can report lethal batches of drugs. That allows us to take that information in. We vet it through the sources that we have, and then we're able to push information to other users that they might want to take extra caution if and when they're using.
What kind of response are you getting to that?
So we've had a couple instances. There was a situation on the Row downtown where there were 3 overdoses in a pretty short period. We were able to vet that the overdoses happened, and then we pushed the information out. We don't hear much back, but we're glad that the resource is there for people that need it.
Well, there are so many different things that you and your family are involved in that help the community, and we're all grateful for that, and it's always a pleasure to see you.
It's always good to see you, Sam.
Come back soon.
I will. Thank you.
And we'll be right back.
Imagine a magical garden that feeds Carson City's hungry and homeless, teaches our high school students agriculture, creates hanging floral displays to beautify downtown, and yet charges nothing. It's not magic. It's the Greenhouse Project. It's real, it's growing, and it needs your help. Go online to carsоncitygreenhouse.org so together we can grow it forward.
Southwest Specialties has been making the homes and businesses of Nevada beautiful for more than 20 years. Their experienced designers and craftsmen create the walkways, backyards, water features, and a variety of outdoor cooking areas that add curb appeal and value to your investment. Call today or visit them at their website and see how they can make your outdoor spaces special. Southwest Specialties, creative, distinctive, beautiful.
Modern boutique Ahern Hotel and Event Center sits at the heart of the Las Vegas Strip. 2 floors of meeting and event space are ideal for groups and conventions. Stay in one of 200 luxurious rooms and suites. Brand your event throughout the property. Flexible event spaces make for easy planning and personalization. Take over the entire hotel with a full buyout option.
Thanks for watching Nevada Newsmakers. You can catch us online 24 hours a day at nevadanewsmakers.com, or you can download the podcast wherever you like to get your podcasts. We'll see you on the next broadcast.